what are the pros and cons of within 24-hour dental implants, same-day implants?
Okay, so which one is that? Oh, 24, I see that, right, okay, all right. So the question is, what are the pros and cons within 24-hour dental implants, or we call it as a same-day dental implant? So what the reader mean or this follower means by same-day dental implants. So there are multiple types of dental implants that are available, multiple type of, not dental implants, I should say, dental implant treatments available. So when as a surgeon, one of the most common reasons why I place dental implants is whenever the patient is going to have a missing tooth. So if I remove a tooth, my goal is to immediately place an implant on that tooth, except for wisdom teeth, of course. So after the removal, as soon as the tooth is removed, and if the site is good enough, what I mean by is, sometimes there is a lot of infection around the tooth, or there is not much bone around the tooth, and so we may not be able to place the implant. So we are placing the implants immediately on the site, the tooth surgical site. What they mean by the 24-hour dental implant or the same-day dental implant is that's exactly what they mean. So you remove the tooth, and at the same time or on the same day you place the dental implant. That can be done for one single tooth, just like I mentioned. You remove a tooth, for example, like a back tooth or a front tooth, whichever tooth, and particularly on a front tooth, you don't want to be walking around with no tooth at all. So you want to remove the tooth, and you want to put the implant, and you want to even put a crown on the same day. That way you don't feel like you have a missing tooth at all. So there are several occasions, and we are able to remove the tooth, put the implant in at the same time, and put even a fake tooth on the top of that at the same time, although it could be a temporary fake tooth to begin with. So that's what those are called, the same-day dental implant. And what they may be referring to is the same-day dental implant. Does not mean like same-day dental implant. That also means same-day teeth. So you may be hearing to advertisements and then commercials on the radio and the TV. People are referring to same-day teeth. So like I said earlier, you remove a tooth and you put an implant, and then you put on the tooth on the same day. So that means not only the same-day implant, but also it's called a same-day tooth. But imagine you're losing multiple teeth. For example, one of the common procedures that I do in my office when patients have a like a complete set of bad teeth, completely mutilated mouth, so completely bad dentition on the bottom, completely bad teeth, set of teeth on the top. So we are often removing sometime, as many as about 16 teeth in the bottom, as many as about total of 32 teeth, 16 on the top and 16 in the bottom. Then we remove all the 16 teeth on the top, remove all the 16 teeth on the bottom, and then now we are putting in 4 in the same day teeth. So now we are screwed. So that's what most people are referring to when it comes to the same day dental implants or same day teeth. And then the pros and cons of those. So the pros and cons, who would not want to come into my office and have a broken tooth, and then they are going to walk out with a fake tooth that looks, feels, and functions like a natural tooth, right? So those are the pros, and those are the pros. So absolutely, there are many advantages. Although I don't recommend you for example, you get a front tooth in my office and immediately walk out of my office, and then you're going to eat the corn on the cob or on an apple. I don't recommend you do that. But for the most part, just going to look and feel for like a natural tooth, at least on the healing period, the same day. But it's just going to start functioning like a natural tooth when it comes to like the 3 months healing period, which is the normal time of the healing. So those are the absolute pros. And then, one more pro I forgot to mention. Imagine that patient coming in to have all 16 teeth removed on the bottom, all 16 teeth removed on the top also, and walking out a complete set of teeth, same day teeth. Imagine what else, what else you can expect. That's how much the medical technology has advanced, the dental technology has advanced, and we are able to offer the same day complete set of teeth to our patients using this technology of same day teeth. So those are the pros that you can think of. The cons, well, like not every single time that we are able to guarantee that we are able to place the fake tooth on the top, like we talked about earlier. So you got severe infection. You have seen that reason in our practice. You got severe infection, or when the tooth comes out, so you got so much of bone destruction, and the bone actually came along with the tooth at the time the tooth came out. Or patients fell down, and then they just not only broke the tooth, but they also broke the bone around the tooth. When those situations happen, we are not able to place the implant. Sometimes if we are able to place the implant, but we may not be able to place the fake tooth on the top of that. So those are the cons of the same day teeth. And then sometimes we do tell patients that other biggest problem that we have is one of the common, we joke in the dental industry, most patients come and say, oh, I was eating on a piece of bread and the tooth broke. But actually they were eating just they're trying to crack a nut. I'm not saying my patients are lying to me, but that's kind of one of the things, they may not be paying attention to what they are not supposed to be doing. For example, if I'm going to give you a tooth, when a front tooth breaks, if I'm going to give you a front tooth implant, and if I'm going to give you a fake tooth on the same day, I'm going to expect you to be careful, not biting into an apple or not biting into a corn on the cob. But if you go home and then either you try to do it, or you unintentionally you forgot and then you just try to grab onto something like that, then it's just going to break. So those are the cons that I can think of. And then sometimes it's patients are kind of really trying to push the limit, and they have whatever the case may be. Whenever we are trying to place the implant, so we think well, I think the implant is going to be okay, and then we try to push the limit and then see whether the Mother Nature will forgive and be a little forgiving, and to try to make that implant heal. And then sometimes the implant does not heal, and so sometimes you may have to remove the implant and replace them. It's not really a cons, and though it's not a problem, and it's just going to delay the treatment time. So that's pretty much there are more positive things on these same day dental implants and same day teeth versus really problems. So anybody who's going to be missing a tooth, you're needing a tooth extraction, or you're going to be losing either one tooth or multiple teeth, and are you a good candidate for a same day dental implant or same day teeth, I would strongly encourage you go talk to your dentist, and then, or if you're in the Dallas-Fort Worth area, come back and see us, and we can definitely help you. I hope I answered this question for you.
Yeah, it sounds like there's a couple.